So, good morning to all the students. So, symptoms usually the continuation of this video will be discussing regarding the clinical manifestations, how the clinical manifestations can be seen. The pain will be from the back to the flank and to the groin. So you'll see that picture. In that picture, one picture we are showing the back, how up to where it is the pain, and then in the front it is a flank, from the flanks to the groin. So we'll confusing with that. Sometimes when it is a when the stone is in the right kidney, will be differentiate the diagnosis with the that is appendicitis. So we have to confirm with that diagnosis. And then some of the key findings and additional signs and symptoms, like having a severe flank pain, abdominal pain, nausea, vomiting, fatigue, or elevated temperatures, and urine analysis is a positive for the RBCs. And then some of the objective data like perspirations and the person will be perspiring and clutching of the abdomen. He will be seen in that picture and doubled over. He will be bending towards and doubled over, and the pain, he will feel more pain, and steady pain will be there. Flank and tenderness can also be seen, and the presence of UTI infections, fever, chills, and the pain in the groin, labia, and then testicles. There will be foul smelling, dysuria, persistent urge to pass. Diagnosis history, physical examination, urine analysis, and imaging studies. So in history we'll focus regarding the past medical history, present family history, and the symptoms of the emergency. Past medical history, any problem, any renal calculi present in family history. In family history, presence of any in family history, previous any history of hospitalization related to the pain or pain in the abdomen, or due to because of any renal problems, or family history of any congenital problems or genetical problems, hereditary problems are there or not. We have to confirm with that. And then one more thing, symptoms of emergency, any emergency symptoms, we have to check it for that. And then physical examination, obviously we will check for the abdomen, pelvis, and rectal examination, and some of the procedures. Urine analysis will rule out for the RBCs and pH, if it is alkaline or acidic, and crystals and bacteria, pyuria, for checking the bacteria in the urine, and some of the imaging studies. So these imaging studies are essential to confirm the diagnosis and to know the size and location of the stone, where it is situated. Differential diagnosis should be differentiated with the bleeding within the kidney, or ectopic, in any ectopic pregnancies, and then aortic aneurysms, and acute intestinal obstructions or appendicitis. So ectopic pregnancy means the pregnancy will be seen in the tubules, in the fallopian tubules. So that is nothing but thing. Bleeding within the kidney, that may be because of any glomerular nephritis or any glomerular problems. When there aortic aneurysm, the aneurysm which is formed in the aorta, that is nothing but the aortic aneurysm. Then intestinal obstruction, because this intestinal obstruction may be due to because of the feces, or because of any fistulas and fissures, it may cause the intestinal obstructions. And then appendicitis, all of you know, the one of the emergency condition. We have to differentiate with that diagnosis, and then we'll go for the medical management, surgical management, and then dietary management. In medical management, we ask the patient to have a more amount of fluids and reduce the pain with the help of the pain medications. The medications are based upon the stones. The calcium stones, thiazide diuretics can be administered for the calcium type of stones, and vitamin B6 can be given. Cystine type of stones, and penicillium can be administered, and steroid stones, antibiotics can be given for this stone, surgical treatment. So 20% of the stone required additional treatment with shockwave lithotripsy. So this is one of the type of the procedure, that is a shockwave lithotripsy. And one more thing is endourological procedures. These are the some of the procedures. So endourological procedures. These endourological procedures lo we are having a transurethral ga. So we'll pass the transurethral one of the scope, a cystoscope or ureteroscope or the ureterorhinoscope. Cystoscopes, it will be up to the what we call will be up to the bladder. And then one more thing is a ureteroscope is nothing but it will be up to the ureter. And then one more thing is a ureterorhinoscope. So this ureterorhinoscope is up to the urethral and renal system. Up to that they will pass the ureteroscope with the help of the guide wire, with the help of the guide wire, and with the help of the breaking machine will be there. With the help of that they will be breaking the stones. After that the stone has been broken into the pieces. When it is broken into the pieces, they will take one piece. Very large pieces can be taken out. Some of the small pieces can be by through the bladder installation it will be coming out. So that is the thing they will be performing. So next procedure is a lithotripsy. This extracorporeal means ESWL. The shock waves can be passed into the ureter or into the this is the shock wave therapy. The shock wave means radiation therapy that can be passed into the past and then breaking of the stone. That is the thing. And percutaneous. So this is a percutaneous lithotripsy. This is a procedure. It is also used to break the stone through the percutaneous. And coming to some of the surgical procedures. Procedures for lithotomy and then cystolithotomy and then nephrectomy. These are the procedures related to the cysto means bladder, ureter means urine within the ureter. Bladder can be within the bladder the stone can be blast. And then nephrectomy is a procedure where opening of the kidney and removing the stone. Nursing management. Coming to the nursing management, mostly acute pain and deficit knowledge regarding, and acute pain related because of the obstruction of the pain and verbalized by the patient by assessment. And then some of the management like administration of the pain medications, non-pharmacological management techniques like meditations to relieve, or some of the imagery techniques to relieve the pain. And then after administration of the medication we have to reassess the patient for pain level. After 1 hour we have to reassess the patient, and we have to remove their concerns and fears which are associated with the pain, and should provide the emotional support to the pain. Deficit knowledge related to the fluid requirements and dietary restrictions. And then risk for infection related to the kidney obstruction. So the deficit knowledge meant we have to give the knowledge regarding then prevention of further more infections that has to be prevented. And then nursing management, I won't go into the detail. You people plan nursing care plan to this and write it as an assignment. And the dietary management. Coming to the dietary management, we have some of the examples of the oxalate foods. So some of the oxalate foods like fruits and vegetables, in nuts, and then beverages and other type of which are sources are rich in the oxalates. So mostly commonly known okra, green peppers, spinach, sweet potatoes, tomatoes, and some of the plums, figs, and then we are having some cashews, peanuts, peanut butters. These are some of the foods which are rich in oxalate types. And nutritional some of the foods which are rich in the foods which are related to the nutritional calcium stones. The calcium stones mean low calcium diet. So low calcium diet can be advised when the patient is having a calcium stones. So approximately per day 400 mg per day can be advised for this patient. And one more thing is advise the patient to take a more amount of fluids, and advise the patient not to take the meat, legumes and nuts. That has to be not controlled, and sodium intake it also be decreased, and they have to take high fiber rich diet. So one low calcium diet, this is the one of the example of low calcium diet. You can take it afterwards. So and then we'll go into the Sistine stone. So when the stone Sistine type of stone is present, at that time advise the patient to take low protein diet or low methionine diet. So in children actually when we are discussing regarding the Sistine type of stones, mostly Sistine type of stones are seen in the children and adolescents age. But in children, advise the patient to take normal diet, no need of the low protein diet. In children they can take this type of normal diet for the growth. And the medical therapy can be given to control the infection and then to produce the more alkaline urine rather than the acidic urine. So some of the diets related to the stones. So type of the stone is over here, and the dietary nutrition modification over here in second column. So we'll see. Calcium means low calcium 400 mg, phosphate means low phosphate 1000 to 120 mg, oxalate means low oxalate, struvate means low phosphorus, that is 1000 to 1200 mg can be taken, and then uric acid means low urine diet can be advised. Cysteine means low methionine or low protein diet can be given. So these are all the types of diets. So you can plan these diets. Which are the food, which foods comes under the calcium rich, and which foods come under the phosphate food and oxalate rich foods and uric acid rich foods, so that you can plan a diet plan to this patient. So avoid this type of junk foods, have this much of the fluid. So mostly prevention part make the patient to hydrate and to take a diet that there is a low sodium, some low oxalate and low protein diet. Depending upon the types of stones, exercise and meditations can be avoided. So these are some of the interesting facts. That is, urine therapy uses urine by applying to the skin or drinking it. And people who get lost at the sea drink their urine rather than they drink sea water. Romans from the ancient times used urine as a bleach for cleaning the clothes. Yellow color of the urine was often thought to come from the gold. So these were the previous thoughts and previous things. So and with this topic I will so till now we have discussed regarding what is meant by the renal stone. The renal stone which is formed through the mineral or some of the acid type of acids combinations with the renal stones are formed. And then if because of the supersaturation of the urine, the stones can be formed, and some of the stones are there that are the calcium stones, oxalate stones, Stewart stones, and then xanthine stones. So these are all some of the types we are discussed regarding the prevention part, medical management part, surgical management part. And then so write it as an assignment, that is the extracorporeal shockwave therapy and percutaneous lithotripsy. So take it these two surgical procedures and write the procedures. And then one more thing, the diets related to the renal, you plan low phosphorus diet and low sodium diet, you plan for the health talks. So with this I complete my topic.